So it's my pleasure to have Leslie and Nolan join us today from Authenticx. So let me do a quick introduction about Authenticx and then an introduction of both Leslie and Nolan, and we'll kick it off. We'll hand it over to them. So Authenticx is a conversational AI company with their finger on the pulse of patients and caregivers navigating the U.S. healthcare system. During this time with Leslie and Nolan, they will share with us, they'll highlight findings from their latest research, which looks at the drivers of friction in the healthcare journey, share how one healthcare system leverages conversational AI to create cross-functional alignment to solve a recurring pain point, and facilitate a conversation focused on humanizing healthcare data. During this conversation, just want to let you know that they are open to your questions, so feel free to use the chat, put some questions there. So they are open to your questions throughout. So please, and they'll also stop periodically to encourage your comments or questions, but please feel free to use the chat or raise your hand and we'll definitely include you in the conversation. So let me give a quick bio for Leslie and for Nolan and then hand it over. Leslie is the Chief Evangelist of Authenticx. I love that title. In this role, she creates awareness across the healthcare industry of more efficient and effective ways for healthcare organizations to deliver on their customer objectives. With over 2 decades of working with consumer experience, letting somebody in the waiting room, Leslie helps clients actualize the voice of the customer to show how these voices prompt meaningful action. And Nolan is a sales leader at Authenticx and has served as a founding member of the company's go-to-market team. In this role, he helps healthcare organizations realize the power of conversational data and how it can be leveraged to drive business and health outcomes. Nolan has spent nearly a decade helping enterprise businesses understand how to harness their data using technology. And I have really been looking forward to this conversation. I think Nolan must be having some difficulties, Leslie. So I'm looking forward to this conversation. I'm hearing so much about what you're doing and especially this latest research. So Leslie, I hand it over and look forward to learning from you. Thank you so much.
Wonderful. Well, thank you, Denise, and thank you, everyone, for taking time out of your day to be with us today. Denise, can you see the slides?
Yes,
yes. Perfect. We've titled our time here today, Helping Healthcare Here, and feel like it's an appropriate title because the work that we do at Authenticx is rooted in the essence of this quote from David Asperger, who he's an author who said, being heard is so close to being loved that for the average person, they are almost indistinguishable. And it's from that lens that we do our work at Authenticx. We believe that there is no greater display of care and concern, or dare we say love in business, than to be heard. And that really is at the root of what we do at Authenticx with conversational AI. It really is about listening to every voice that is spoken in the healthcare journey. And so today, we've got just a short introduction. Denise already introduced Nolan and myself, but would like to also introduce you to Authenticx. So Nolan will, if Nolan's sound is working okay, he'll walk us through that. And then we just wrapped up some research, and we thought, what better way for you to learn about the work that we do at Authenticx than through the insights that we surface for the healthcare industry and for our clients. So we'll share with you some industry research that we've done, and then Nolan will also share one case study from a health system that we work with and share with you how they leverage conversational AI to demonstrate their care and concern for their patients and caregivers. So as Denise mentioned, feel free to chime in as we go. We will also be pausing periodically and just seeing if you have any questions or really to hear kind of your reactions to some of the information that you'll see. I've spent my entire career in customer experience, and I've spent it in a couple different industries. And before Authenticx, listening to the voice of the customer was primarily driven by survey data. And what I have seen in the work, in the compare and contrast of the work of survey data as the voice of the customer versus conversational data, it's like night and day. It is surface level versus deep roots understanding as a comparison, where survey is very surface level, conversational intelligence is very root cause understanding, highly contextual data. So I spend my time at Authenticx really helping to open the eyes of healthcare leaders to a more efficient and effective way of listening to the authentic voice of the customer and really moving beyond survey data to listening into the everyday conversations that customers are having with healthcare entities. So I will turn it over to Nolan for an introduction.
Thanks, Leslie. And really quickly, can you all hear me okay?
Yes.
Yes.
Perfect. Yeah, I continued to lose audio from my computer, so I just joined from my phone. So thanks, Leslie. And Denise, thanks for having us. Appreciate the opportunity to be here and to meet with you all. As Leslie mentioned, my name is Nolan Bernard. I've been with Authenticx for about 2.5 years. Similarly to Leslie, most of my experience, professional experience, is in the customer experience space. So to be a little bit more specific, I've spent the last 10 years or so in the software and technology world, helping consumer brands better understand their data and the data that they have access to from their consumers, leveraging that data to better understand their customers and the individuals who they would like to be customers. So here at Authenticx, I help to lead our sales organization. You'll hear more about this shortly, but we sell into 3 different verticals inside of healthcare. So pharmaceutical, payers, and then providers. So I mainly focus on the payer and provider verticals. Okay, so I'm going to jump to just a quick introduction of Authenticx. So we are about a 6-year-old company. We're headquartered based in Indianapolis. That's where Leslie and I both sit. And simply put, we are a conversational AI company that was founded to help humans understand other humans. If you were to Google conversational AI right now, there would be no shortage of results, but there would be a very wide variety of results. And most of what you would see probably is not exactly in line with what we do. So hopefully we can shed a little bit light on what we do today. At our core, we really exist to wrap structure around unstructured conversations that healthcare entities are having with their customers, with their patients, with their members. So as Leslie mentioned, surveys are kind of core and near and dear to the business of healthcare. We don't dispute that there's value within surveys, but we think that there's a better way. We think there's a better way for the industry of healthcare and the businesses that make up healthcare to listen to and collect feedback on their customers and the people that they're striving to serve. So that's just a brief introduction. I'm going to jump to the next slide here, Leslie. So as I mentioned, we work across healthcare verticals, really working to help the healthcare organizations that we serve achieve their strategic objectives by way of listening and listening to conversations they're having with their customers. So I really distill it down into 3 ways that we can help. We can help to elevate the customer side of the conversation. What are your patients telling you? What are they saying? And how can you capture that at scale? We can help you improve the way that your own internal employees are performing and representing your brand, representing your company by elevating their voice and helping you to understand where they can be better enabled or how they can be trained and onboarded more effectively. And then lastly, but maybe most importantly, is the operational waste that exists inside of healthcare. We're really good at listening to healthcare conversations and pointing out to an organization where waste exists and where it most frequently is occurring so that you can reduce that waste, which ultimately will improve the experience of both your employees and your customers. So you can see some measured outcomes here on the screen where we've been able to significantly increase the overall performance and quality scores for agents working inside of contact centers in healthcare, reduce the amount of churn that exists within a healthcare organization and helping them to retain more of their customers, and then helping organizations sell more of their products, helping them to improve the growth of revenue inside the organization. It's just a little bit of background, and we can get into more detail as we go along here, but Leslie, I'll pass it back to you.
Wonderful. Thanks, Nolan. So that's a very high-level introduction to Authenticx, but we thought that the best way to really learn about what we do is to share with you the types of insights that we help healthcare companies uncover. And what we're going to share with you, actually, you're the second group to see this data. We shared it a couple weeks ago with our clients who came together in Indianapolis, Indiana for our first ever conversational intelligence get together called Voices 23. This research was rooted in the discovery of what is driving friction in the healthcare journey. And as Nolan mentioned, Authenticx is an AI company, and we recognize that there's a lot of hype around AI right now, and there's a lot of confusion. It's an umbrella term, but one of the applications of AI is called machine learning, and it's where you use training data and you teach the machine how to learn. And one of the things that we are teaching our machine to learn is friction. And we call that the eddy effect. This label comes from the concept of whitewater rafting, where water flows down the middle. It flows fastest down the middle of a river, but not all water can flow down the middle. Some gets pushed out to the side. And when it encounters a boulder, water starts to cycle counter to the current, which happens every day in the healthcare industry, where we're not able to move down through our journey. We hit a boulder and it causes us to spin and stay in place instead of moving down. And so one of the things that we have been doing over the past several years is teaching our machine learning model to detect this friction when it is spoken or written in a communication. So a chat communication or spoken verbally over the phone. And we call that the eddy effect. And so this research was really focused on understanding what are the drivers of this friction in the healthcare industry. And we thought we would start by having you hear what this friction sounds like. So we've got what we call a short montage, which our clients use every day to help connect their colleagues to the voice of the customer. We've got a short montage here of common eddies that we hear in the healthcare industry. You'll hear 3 clips. They're short clips they're actually recreated clips from real live examples. In between each of the clips, you'll hear a beep that just signals that we're gonna hear the next clip. So here's an example of 3 common eddies.
We're the providers of her home health care services, and we've sent over a few different plans of care that we need the doctor to sign, and still haven't gotten any response. There's also 2 prior ones that have been sent and never returned. And I'm afraid what's going to happen is, she desperately needs our services, and she's going to lose her Medicaid prior authorization if we don't get this sent.
I called you already on this, and then I checked with the clinic. They said they had faxed you the records you were asking for a week ago. She said she called you all and asked for the fax number, then faxed the records. But you're saying there are still no medical records showing up right now? Ugh.
So I spoke to another agent earlier about my husband's prescription because we're trying to start the refill process. And that agent said that it was going to be filled by my pharmacy. So I spoke with my pharmacy, but they said it had to be filled by a certain specialty pharmacy. So I then called them, but they said they can't do anything because they need the prescription from you. And they're waiting for you and haven't received it. But now you're saying the specialty pharmacy would have to give me a call back, basically, to request the transfer of this medication. Or they can reach out to my doctor's office and get the prescription sent that way. And that you think I should also give my doctor's office a call and have them fax the prescription to the specialty pharmacy? Okay.
So there you have an example of 3 common eddies that we hear through the conversations that we analyze. And over the past several years at Authenticx, our machine learning models, our AI, has listened and analyzed hundreds of millions of healthcare interactions. And as Nolan mentioned, they're interactions that are spanning different verticals of healthcare. And through our analysis of these conversations and of the eddies, we've learned several different things. First is we have detected in 21% of those hundreds of millions of interactions an eddy. That's 1 in 5 interactions. Our machine learning models are detecting that there's some sort of friction in the journey. That's way too high for an industry with so much that's on the line. We know through our platform, through conversational AI, that there's a significant impact that eddies are having a significant impact. And we see it in a couple different places. One, we see the impact that eddies are having on care alone. So of the 21% of eddies, in 46% of those, we see that that eddy is delaying or preventing care for someone. So it's having a significant impact just on care delivery. It's also impacting customer perceptions. We see this measured through sentiment. We will look at beginning and ending sentiment in a conversation, and we see that the average ending sentiment on a 5-star rating, when across all of our interactions, leans more positive. For eddies, it's more on the neutral category. So we're seeing just the perception alone of an interaction being impacted by eddies as well. And then, as you can imagine, there's a significant impact just in terms of time. And we see that eddies on average are taking about a little over 9 minutes. This is about 2 minutes longer than an interaction where an eddy is not detected. Through our work, we know that eddies are completely avoidable experiences. And so when we look at just the time factor, we can put an estimated cost against it. And so just in terms of the cost of time alone, for the companies that are in the Authenticx community, we're seeing over $300 million a year that are spent across industries helping people navigate through friction in the journey. That's a significant amount of money. And that is just within the Authenticx community. That's not even all of the other organizations that we're not working with. So we set out to understand, what are the drivers of this friction? What can companies do to remove friction from the care journey? And we adopted this framework to help us kind of organize our research. So we're curious, are people the cause of eddies? And for this category, we're looking at kind of the humans that are involved in the customer journey. So things like human error or just human capacity would fall into this bucket. Or is technology a factor? Is it driving these eddies? And these are IT systems. We see a significant reliance on fax machines, patient portals, and things like that. Are they getting in the way of patient? Are they causing patient friction? And then process was the third one. These are kind of steps that are created to help someone navigate through their care journey. So we designed this research to help us understand what's driving these eddies. And we've already heard examples. Oh, Denise, did you have a?
I was going to pop. We had a question from Sebastian in regards to the prior slide. And he asked, in the previous slide, how is care defined when we say 46% of care is delayed or prevented, such as a task from an encounter visit or something else?
Yes, it is defined very broadly. So it could be a delay in getting medication. It could be a delay in getting an appointment to go see the doctor. So it's any type of delay or prevention of getting care, whether that's seeing a doctor or getting on a treatment plan.
Thank you.
You're welcome. So we heard examples of these 3 eddies earlier in the montage when we heard, you've sent over a few different plans of care that we need the doctor to sign, but we still haven't gotten a response. So that's kind of the human capacity type eddy. She called you and asked for the fax number, then faxed the records, but you're saying you still don't. So that's a technology example. So I called them, but they said they can't do anything because they need the prescription from you. So that's kind of the series of steps example. So we got really curious about the eddies, and we were very specifically looking at which variables drive the most eddies, what is underneath that driver, what drivers are kind of most and least commonly resolved in an interaction. So sometimes an eddy can get resolved in the conversation. So we looked at resolution, and then how do they differ across the healthcare verticals? The approach that we took for this research is we took a representative sample of just eddies. We only looked at eddies. We didn't look at kind of other interactions that weren't eddies. We wanted to make sure that the insights were reflective of the industry as a whole. So we evenly distributed the eddies across verticals. We didn't want one vertical to over or underweigh the analysis. We took a broad range of variables, things like who was the customer? Was it the patient? Was it the caregiver? Was it a pharmacist that was trying to navigate on the patient's behalf? And we used a research approach called constant comparative analysis to help us isolate a variable, compare it and then look at other variables and compare it to see what emerged. We learned a ton, but today we have 3 different discoveries that we'll share with you from this analysis. The first is the main, oh, Denise, was there a question?
No,
Okay.
sorry.
So the first discovery was the main research question, and that is, what is driving it? Is it people, process, or technology? And we found that overwhelmingly eddies are driven by processes that we have created. Now, we realize people create processes and but it's the process that has been designed that is causing the eddy. Here's what that looks like. So one interaction can fall into multiple categories. So don't try to add these up because they're going to go over 100. But we found overwhelmingly that the eddies that we analyzed fell into this category of process. And what compounds it even more is when we look at the resolution of that, we see that not only are processes the main driver of eddies, but they are also significantly less likely to be resolved on the call. So that means they require a next step after that customer interaction compared to people in technology. So we got really curious to say, okay, what's underneath this? What are the processes that are driving these eddies? And we found 4 broad buckets, which I'll walk through each of these to explain what is included. But we found these 4 broad buckets of processes that are driving eddies. The first is a process related to paying for care. So this is things like claims process, getting a prior authorization. A lot of pharmaceutical manufacturers offer copay cards. So the process of enrolling in copay, getting approval, and all of that falls into that paying for care process. The second is these gaps in communication. And these are things like, someone said that they would call me back and they haven't called me back, so I'm following up to see what's going on. Or they don't have visibility into the status of what's happening with their claim, with their prior authorization, with their copay. So it's that communication aspect of the process, or that they're just not able to reach the appropriate party that they're trying to get in contact with. The third is around accessing care. So this is about getting your refill, getting your medication refill, or getting the shipment of the medication, or getting a referral for a doctor. Those were the broad categories that fell underneath accessing care. And then the fourth area here is around information and documentation. And this tends to have some overlap with kind of incorrect information being submitted. So a little bit of human error here, conflicting information. I heard this from one person, this from something else, or this piece of information, and incomplete or missing information. So those are the kind of broad buckets underneath the process drivers. When we look at this chart, here's kind of what we see from our lens. The first is, we are not surprised to see that paying for care is the largest. It goes across all of the verticals. Everyone gets involved when it comes to paying for care. So it requires a lot of coordination and handoffs as well. Similarly, we were not surprised at seeing gaps in communication high, because a lot of kind of issues kind of come down to the root cause of being communication. It's also another example of a category that falls across all of the verticals. What did surprise us, though, is that these first 3, the distribution between them isn't as big as what we would have thought. I would personally was surprised that paying for care wasn't larger and a bigger gap between that and the other categories. So seeing those 3 come pretty close together it didn't surprise us, but it was a little bit different than what we would have anticipated going into it. So I'm going to pause there and see what questions you have based on the first discovery, or any reactions.
Sebastian shared that last year, when analyzing patient experience survey data for his organization, they also found the main drivers of staff and patient friction with process and workflow. So he wasn't surprised. Yeah.
Awesome.
Hi, I'd add that this was also across different departments. So medical, dental, behavioral health, urgent care, all the same thing, points in the same direction.
Yeah. Good, good thing that there's consistent message across different types of research. So the second discovery came from a further analysis of the process-related eddies. So I mentioned earlier, we use this approach called constant comparative analysis. And so I'll go back to this slide. What we did is we studied each of these individually and said, okay, let's just isolate paying for care and see what emerges. And then let's isolate gaps in communication. And when we isolated gaps in communication, we discovered that there's this win-win opportunity in healthcare. And the win-win happens if we solve for gaps in communication. We're also supporting the people who are involved in the care journey along the way. So not only are we removing a barrier, but we're helping the people in the process. Let me show what this looks like from a data perspective. So this is the chart that we saw earlier where process was the biggest bubble. If we take the 41% that were within process that are gaps in communication, and we compare it to this people bubble, we see that they're about the same size. They're virtually identical to each other in terms of the size of the eddies. But what was interesting to us is that they also overlap with each other, telling us that we have this opportunity to create a win-win for our people who are helping our customers navigate in their care journey. When we looked at the process-driven communication gap eddies, we see that they are largely driven from two different factors. One is the customer anticipated receiving a call back or some kind of interaction back and they haven't heard. And then the other is they're just checking on the status. They don't know. They're sitting there kind of in limbo and they're not sure. So they're being proactive and reaching out. And so this sounds like in customer interactions, we've got just a couple kind of quotes to illustrate what this sounds like when someone calls and has a gap in communication. It sounds like they said that by 2 weeks I should get an update already, and so far there's still no activity. Or I've been waiting for my reimbursement on my medication and I've not received anything yet. I really need the money. I think they spent maybe 2 or 3 messages and the patient is still waiting to get their copay assistance approved and she's anxious. Nobody told me anything, and we've been waiting patiently for this information. I was told that someone with your office would give me a call back within the next day or 2 business days, but no one has called me back. I have not yet received a return call from the nurse's assistants. I talked with her 2 days ago. So we hear this every day in our work. Our clients hear this every day in their work. And we got really curious and did a little bit of external research and saw that the impact of waiting, it's not just a burden, but it has a physical impact on health as well. Because when we're waiting, and particularly in a situation where we're waiting and there's a lot of uncertainty that could be negative, it increases our anxiety and it increases stress on us. So we're not just talking about a burden, but we're also talking about solving for an issue that is causing kind of negative health effects as well. Now we know that healthcare can kind of get a bad rap sometimes for not looking outside of the industry for inspiration. And so we took just a little bit of a moment to do that. And we got our inspiration from no other than the Domino's pizza tracker, because Domino's has solved for this problem of transparency and this problem of gaps in communication. And what we learned from the Domino's pizza tracker are 3 things that you might find interesting as well. The first is the age of the Domino's pizza tracker. It is 15 years old. Domino's launched the pizza tracker in 2008. So this technology, while it's for pizza tracking, but the technology of helping human beings know the status has been around for 15 years. The other thing that we discovered in studying the Domino's pizza tracker was the origin for it. In 2006 and 2008, Domino's was in a crisis. It had to do something to change. And during this time, they decided to prioritize transparency. And the first thing that they did was a very public announcement that their pizza sucked. Yes, they told us all that their pizza sucked. That focus of transparency, though, led into all of the things that they did, which drove them to the pizza tracker as well. The third thing, interesting thing, Domino's. In 2008, Domino's stock was at an all-time low at $2.83. I checked it this morning, and their stock was at $354.05.
Wow.
So significant impact on their business through the prioritization of transparency to their customers, visibility. It's not just the pizza tracker that did it, but it was this kind of emphasis on transparency. So that was discovery 2, all around kind of gaps in communication being an opportunity for a win-win. Any questions about that? No? Okay, third discovery is one that we weren't looking for. It kind of found us, and it came to us when we focused on unresolved eddies. So most eddies don't get resolved in an interaction, but some do. And we found that unresolved eddies fall onto 2 different personas. The burden of resolution falls onto 2 personas. The first is our physicians and our doctors. The second is the patients and the members themselves. Now, a couple things I'll say about this finding is every vertical is responsible for this. So the burden of resolution falls to our doctors and to our patients across all the verticals. Now, it is more common to see the burden falling to the physician within hospital systems and within pharmaceutical manufacturers. So they're tending to look towards the physician, the doctors, for the next step. The payers are more likely to look towards the patient or the member for the next step in their resolution. And the next steps are things like, for patients, it's calling the pharmacy, calling the provider, connecting with the insurance companies, submitting an appeal, looking into a claim, requesting a prior authorization. And for HCPs, it's things like returning calls regarding lab results, submitting medical records, completing documentation, changing billing codes, submitting referrals. You see it. I mean, just the administrative burden that we've created in the healthcare system is tending to fall on our doctors, which I suspect we all have kind of points of view about that and the burden that we're placed on them. And then the patients themselves who, through our work every day, aren't equipped to navigate. It's complex and it's hard to navigate just the language alone, better yet, kind of all the entities and navigating across them. So that was third discovery. Any reactions or questions to that? No? Okay. Just a quick summary. We've talked about 3 discoveries. Eddies have a significant impact, and they're largely driven by processes. We've heard that that's also shared in other research out there, so that's great. Opportunity to really focus on these gaps in communications can create a win-win for the customers in their navigating and also the people as they're helping them navigate. And then the burden is falling on the physicians and the patients for next steps. Some of the things that we can each do is really look within our business to identify the process drivers of eddies within our world, look to prioritize the opportunities based on their impact to health, their impact to the business, and the feasibility, and then really focusing as we're fixing processes, making transparency a priority to help close the communication gap. So that is a summary of the research that we did. That is what conversational AI is equipping businesses with, the insight that they need to really, this example is about removing friction, but you can also apply it to helping to elevate the skills of our frontline team, or helping to coach and engage them in their work, or helping achieve digital transformation as well. So before I turn it over to Nolan for a case study with one health system. Any questions about this research, or I'd love to hear reactions to what you heard.
Well, Sebastian said, I've seen all of those phrases in patient and provider comments somewhere. So I think that none of it was a surprise. I think for me, it's the volume of it. And when you put some of those numbers, especially the millions of dollars to all of this, that really highlights the problems here.
Any other reactions?
I'm not seeing anything in the chat. Oh, Tony has her hand up and Julie has her hand up. So I think, Julie, yours must have gone up first.
Hi, can you hear me, Denise?
Yes, I can.
Okay, I'm actually wondering if Tony and I are thinking of the same thing actually as well. Love the info, love the research, and you hit a lot of important points here. When you look at your kind of descriptors around people, process, and technology, I couldn't help but think of Donna Bedian's model of structure, process, outcome, and how aligned this work and your findings are with when we kind of take a look at how to improve around structure, process, and outcome. Usually, obviously, structure, people, and kind of your the way that your organization is structured. Process is just what you've defined, and in that model, technology kind of falls in that space too, if it's working or not. And then of course outcomes, how this is affecting is where you started, patient outcomes, people outcomes, communication, etc. So just wanted to lift up that alignment, very similar approach, which certainly speaks to us healthcare folks.
Love it. Thank you for sharing that, Julie.
Sure thing.
And Tony.
Hey guys. So Leslie, it was interesting to me to hear you talk about, I guess when you were talking about resolution and some of the resolution falling to the physician, which I found very interesting because I think in my experience, I don't see it really falling to them. So I think that, I found that very interesting and kind of maybe where that came from. And does a lot of your work sit in a call center type space?
Yeah. So I'll start with the second piece of that, which is, does this data reside in call centers? The bulk of it is from contact centers. So whether that is a phone or a chat interaction, it also spans a lot of different types of contact centers. So we get interactions from scheduling, from billing, from nurse triage, from financial support, from member services. So it covers a broad range of types of contact centers as well. And then in terms of it falling on the physician, it is primarily coming from the two verticals, pharmaceutical manufacturers. A lot of the interactions that patients have with them is around financial assistance, so getting copay approval, and the manufacturer requires information from the doctor in order for that process to work. So the prescription is needed, prior authorizations with the payer are needed, and things like that. So that tends to be from the manufacturer side of it. From the hospital system, it's similar. So nurse triage will be, I need to talk to the physician to ask what to do in this instance, or let me follow up with the physician to see if I can get your prescription refilled. Those types of next steps falling on the physicians.
Okay, yes, that definitely makes sense, and I've definitely had that experience in the med practice setting. And I think it would be interesting to see the burden on nurses who are the primary intaker of all that information, whether it's authorization or prescription refills or the triage, and then they're the ones going to physicians or primary caregivers. So it'd be interesting to see the burden there on them.
Yep, yeah, that's a great point.
And Brandy put in the chat, the physicians within small practices do not have the staff or bandwidth, so they end up spending time taking care of these issues, barriers to value-based care.
Yeah, good point, Brandy.
And Tony, your example, if it goes to the nurse or somebody on the front line first and then to the physician, we may not be able to listen to the entire scope of who's impacted, I wonder, question mark?
Yeah, we might not be able to hear all of it, but we might be able to hear, I need to go do this, like what the next step is, but not necessarily kind of hear the outcome of that.
Right.
We wanted to also share with you an example of one client. So that was more of an industry analysis based on conversations that we've analyzed, but I'll turn it over to Nolan to share a case study.
Yeah. Thanks, Leslie. So before I get into the case study, I think you'll definitely see a lot of what Leslie just talked through kind of shine through in this one case study, which I think will be pretty cool to see. I'll also quickly comment on your question, Tony, around the contact center or the call center, and really why we have chosen to prioritize that data. And simply put, the reason that we lean into that data source in particular is volume, the volume of data and the richness of the data that lives and resides inside the contact center. So if you think about any given healthcare organization, healthcare enterprise, more than likely there are going to be tens of thousands at minimum, tens of thousands of customer conversations, interactions that are taking place on a monthly or quarterly or annual basis. And the types of conversations that exist in a contact center in many instances are made up of phone calls. So we've got the ability to ingest those conversations and run our analysis in a way that captures a significant volume of insights, but also contextual insights that you just don't see or that you just can't tap into if we're thinking about a survey or a email interaction or many other methods of feedback. So I think it's worth calling out kind of the power and the value of that data source. The other piece is within your contact center, you have customers, patients who are proactively and organically choosing to reach out and share about their experience. It's a really natural and organic way to capture the voice of your patient and to understand what they might be going through. And you don't have to burden them, or you don't have to prompt them for that level of intel or that information. So there's a lot of different reasons why the contact center makes sense. So I just wanted to highlight a couple of those things. The last thing I'll mention before getting into the case study, I just want to quickly highlight functionally, how we execute on what we execute. So Denise, you had mentioned the sheer volume of friction or eddies that might exist inside of healthcare. You mentioned just how eye-opening that was. Mm-hmm. That's the response that we receive. But the power of our technology is the ability to analyze that volume. There's the tagline that we frequently use is listening at scale. So when we begin to work with a customer, the friction that we identify, the friction that we pinpoint, the friction that we bring to their attention, typically it's not a brand new learning for them. Typically it's a form of friction, a version of friction that they're aware that exists within their organization. The thing that is surprising is what you said, Denise. It's the volume or the prevalence rate for that friction. They were anecdotally, they knew it exists, but they're completely blindsided or taken back by the frequency at which it's happening. And that's the power of our system, is to be able to listen at scale, capture the volume, capture the prevalence rate, and then drill down and get into specific examples and understand exactly why and when something is happening. So just a couple of comments there and I think notes worth making. So looking at this case study, this comes from a health system we work with, a top 10 university health system. And you can go ahead and advance, Leslie. For this organization, we ingest conversations from multiple different areas. So the scheduling department, customer service, and then the nurse triage team. Earlier this year, we started hearing a recurring theme in these calls around the medication refill process when talking specifically to the nurse triage teams. We used AI to listen to these interactions at scale and find calls that were specific to prescription refills using the approach that Leslie referenced earlier, constant comparative analysis, to analyze these interactions. This allowed us to look at the interactions from different perspectives and use data-backed storytelling to incite any action that needed to be taken there. In short, these nurses were finding themselves not operating at the tops of their licenses due to the nature of the calls they were receiving, which pointed to some broader flaws around the phone tree, the decision tree, and how these calls were being routed. Leslie, you can advance. So the power of our system is the ability to really apply a single lens across different silos or different parts of the organization. We're really focused at keeping the patient in the middle. We use this constant comparative analysis to understand what was happening from a few different organizational silos. Specifically, we looked at it from the nurse's perspective, the physician's perspective, and then the scheduling team and their perspective. This approach allowed us to see where issues were arising, and more importantly, how we could simplify the process. Some of the things that we learned or picked up on from a physician's perspective, prescription errors and delays being caused by the provider. For schedulers, incorrect expectation setting. So working with the scheduling team to improve how they set expectations for patients to reduce the need for people to call back, or to reduce the number of times where patients were disappointed or were not aligned with expectations. And then the refill line, so identifying different process barriers. How can we clean up the process that makes it more simple and makes it easier for patients to capture their refills? In addition to kind of the software and our ability to analyze this data, we also offer some strategic services that we describe as insights presentations. So what we were able to do is to take all of this data and work with the customer to bring these different groups, these different functional areas together in one setting, in one room, and really begin to walk them through this data, even play call montages that provide examples of these calls and what we're hearing in these calls, and bringing all these folks in the room together and highlighting this big data while also providing literal examples of the customer voice really helped these different functional areas to understand one another and to understand the perspective of their colleagues in a way that drives change that this organization, I don't think, had experienced before. In terms of some outcomes, we've been working with this organization for 2+ years. There's been a lot of different outcomes, a couple that we'll highlight here. So we're able to shrink the volume of non-clinical calls going into that nurse triage line by 26%, which minimized the administrative load, the administrative burden on these nurses, and allowed them to work at the tops of their license. They spend their time triaging patients, which lessens the number of messages going to physicians. So in a roundabout way, physicians also had the burden, the administrative burden reduced on them. Nurses were more engaged in their work and in removing friction of the patient journey. So there's an uptick in satisfaction for the nursing team and ultimately nurse retention. And then ultimately the patient experience is improving as they continue to tackle the barriers that kind of get in the way of patients and the success of the organization. That's just one case study that we wanted to highlight. Funny enough, I think it's pretty relevant based on some of the questions we heard and a lot of what you covered, Leslie. If there's any questions on that case study, I'm happy to talk through it. If not, we can open it up to Q&A. We've got a QR code here that will, if anybody's interested, will take you to our newsletter. So Authenticx has a newsletter called Pulse, and it's a really great way to stay up with us, what we're doing, but also more importantly, just general industry news and things that you might care to keep up with.
Leslie and Nolan, thank you so much. Since we've got 2 minutes to the top of the hour, I'm going to say thank you and kind of transition to the next. But what I want to be able to say to the full group is, though we're going to transition to speed networking, if you would like to have a little bit of extra time in open QA discussion, we can do that before we transition. So please feel free. I'm fine with us using that time for that. Leslie and Nolan, thank you so much for everything you shared. I have a list of questions that I will have to find another opportunity to ask, but I thank you for everything you shared. The research you've done is tremendous. It's of great impact, I feel, to the work that patient experience professionals and healthcare organizations are doing. But I want to, again, I'll just say for everybody on the call, we'll be transitioning to speed networking, but I'm happy to open it up for Q&A and discussion before we do so.
I don't have a question at this point, but since I'm not going to be able to stay, unfortunately, for the speed networking, which I try to be available for because I really like it, just what I've observed and learned about the way Authenticx approaches their work, I'm very impressed with the organization. And this is not a plug. I'm not getting any bennies from Leslie or Nolan for mentioning this, but I through my work with consulting, I look at a lot of different ways to approach the voice of the customer, and I think one of the more underserved, certainly in the healthcare provider part of healthcare, is in the conversational AI space. And I can't say I know every conversational AI solution or company in the space that serves healthcare or that has a specific focus on healthcare. But if there's anybody working in a healthcare organization who's part of this call, and you think there's an opening for in your organization for having that kind of discussion, I would encourage it. And I wish I could stay longer, but it was great getting a chance to watch Leslie and Nolan do their thing.
Thanks, Lonnie.
Yeah, thank you, Lonnie.
You guys have a great afternoon.
You too, Lonnie. Glad you could join us.
Thanks, Lonnie.
Any other questions or comments? So just a quick question, Leslie and Nolan, are you healthcare only, or do you use your services elsewhere?
Our platform is industry agnostic, but we choose to focus on healthcare. We have had non-healthcare clients, but our resources are directed towards helping healthcare here, helping healthcare simplify the experience, remove friction from the journey as well.
Excellent. All right, so if there are other questions, please feel free. Otherwise, we'll transition to speed networking.